Hello everyone, glad to see you again. In last 3 lessons, we have learned the general introduction of Chinese medicinal herbs, which are properties and actions of Chinese medicinal herbs, compatibilities of Chinese medicinal herbs, contraindications of Chinese medicinal herbs, dosage and administration of Chinese medicinal herbs. Today, we continue our study of specific discussion of Chinese medicinal herbs. In this section, we will learn the diaphretics or exterior syndrome relieving Chinese medicinal herbs. Let's start. What are the diaphretics and what are the functions and indications of diaphretics? These are what we will figure out after class. Any Chinese medicinal herb that has the actions of dispersing or expelling pathogens from the superficies and relieving the exterior syndrome by means of perspiration is considered to be diaphoretic medicinal herbs. These kind of medicinal herbs are mainly attributed to the lung and bladder meridians. They can promote sweating and disperse pathogenic factors from the superficies. They are mainly indicated for the superficies syndrome caused by exogenous pathogenic factors attacking the body, such as aversion to cold, fever, headache, general soreness, or osmosis perspiration and floating pulse. Diaphretics are divided into 2 kinds: herbs for dispersing when cold and herbs for dispersing when warm, which should be selected according to the differentiation of syndrome. If a weak patient is attacked by exogenous pathogenic factors, he should be treated with diaphretics combined with tonics so as to strengthen the healthy qi and eliminate pathogenic factors. Now, let's study the first category: diaphretics with pungent warm property. These kinds of herbs are most pungent in taste and warm in nature and have remarkable action of dispersing when cold from superficies. They are indicated in patients with the exterior syndrome caused by when cold, which are characterized by chills, fever, anhidrosis, or osmosis perspiration, headache, general soreness, thin and white tongue coating, floating pulse. The representative herbs is Ma Huang. The producing areas of Ma Huang are mainly in Hebei, Shanxi, Gansu province and in the Mongolia Autonomous Region. The medicinal material is collected in autumn, dried in shade, and cut into pieces. Medicinal properties of Ma Huang is pungent and slightly bitter in flavor, warm in nature, and attributive to the lung and bladder meridians. It can induce sweating to relieve superficial syndrome and disperse the lung to relieve asthma and promote diuresis to treat edema. It is used for superficial syndrome due to wind and cold. Since this medicinal herb can strongly promote sweating, so it is often used for superficial Succinia syndrome due to wind and cold, which is manifested as aversion to cold, fever, anhidrosis, headache, stuffy nose, floating and tight pulse. For Section syndrome with cough and dyspnea, it is indicated for all syndromes such as cough and dyspnea due to stagnation of lung qi or cold, heat, flying, or retention of fluids, whether they have superficial syndrome or not. It is combined with 杏仁 and 甘草 to treat cough and dyspnea due to wind and cold accumulation in lung. It combined with 干姜, 细辛, 半夏 like 小青龙汤 for retention of cold fluid in the lung, manifested as profuse watery sputum. It may also be combined with 石膏, 杏仁 and 甘草 to treat syndrome with asthma and yellowish thick sputum due to stagnance of lung heat, such as 麻杏石甘汤. For wind edema with exterior syndromes, it is often combined with 生姜, 白术, such as 月碧加竹汤. Besides, it also indicates for wind cold B syndrome, deep-rooted carbuncle of N type, subcutaneous nodule. It is often combined with 熟地黄, 肉桂, such as 洋河汤. 3 to 9 grams is used in decoction for oral use. The crude form is suitable for inducing sweating to relieve superficies, and the prepared form with honey for relieving cough and dyspnea. Next, we will learn 桂枝, the branches of laurel, in the Guangdong province, Guangxi and Yunnan autonomous region. The medicinal material is collected in spring and summer. Medicinal properties of 桂枝 are pungent and sweet in flavor, warm in nature, and attributed to the heart, lung, and bladder meridians. The functions of 桂枝 are inducing sweating to relieve superficies and activating yang and circulating qi by warming meridian. The indication of 桂枝 are as follows. First, it is used for the superficial syndrome due to wind and cold, whether the syndrome is sufficient and deficient. For the wind-cold syndrome with spontaneous perspiration due to superficial deficiency, it is often combined with 白芍, such as 桂枝汤, to keep the action of 阳气 and 胃气 in balance. It is combined with 麻黄 to treat Section syndrome of the superficies with hydrosis. Second, it is used for pains due to blood stagnance caused by stagnation of cold. It is combined with 泻白 and 枳实, such as 瓜蒌泻白桂枝汤. For the treatment of the weakness of thoracic yang, the obstruction in heart channel, and the thoracic pain causing the thoracic B syndrome, it is combined with 附子, such as 桂枝附子汤. For the treatment of arthralgia due to stagnation of wind, cold, damp, combined with 桃仁、牡丹皮, such as 桂枝茯苓丸. For the treatment of irregular menstruation, dysmenorrhea, or abdominal mass due to blood stagnation caused by invasion of cold. Third, it is combined with 茯苓, 白术, such as 苓桂竹甘汤, for the treatment of palpitation, dizziness, and fullness in the chest due to retention of fluids. 3 to 9 grams is used in decoction for oral use. Both 桂枝 and 麻黄 are diaphretics for dispersing when cold, whereas gui zhi is moderate in action and weaker than ma huang in inducing sweating. It can be used for spontaneous perspiration due to superficial deficiency and can be combined with baishao to warm the meridians, activate yang, resolve fluid retention, and induce diuresis. Since ma huang is a medicinal herb, mainly attributed to the long meridian and has the strong action of perspiration, it is often used for exterior Schneider syndrome with anhidrosis due to wind and cold and can disperse the lung and relieve asthma. Promote diuresis to relieve edema. That's all. Thank you. I will see you in next class.